who you are and a bit of history, and then introduction, why healthcare IT. But I still haven't told you what is healthcare IT, have I? I didn't tell you of course I said hospital, this and that, but what is it within your hospital? What is it with your patients? So I'll go one layer down, not too detailed. I think I took up about half an hour so far. Let me just go one layer down quickly, right? And then I quickly cover what are the, opportunities. So healthcare IT, or rather eHealth. So there's a lot of definition. You will see terms like healthcare IT, eHealth, medical IT, medtech, stands for medical technology, various definition. So the guys who come up with the definitions are the who's of the world. When I say who's of the world, I'm talking about WHO, World Health Organization. There is HIMSS, I think it's Healthcare Information Management Societies of the world, a system and societies of the world. And then we have the eHealth Consortium of the world. We have too many of them, all right? But whatever you take, the gist of it, right, is basically application of internet or any other technology for healthcare for various goals and objectives. That's how broad is eHealth, right? Because eHealth starts from, that glucose machine you use, your father, mother, or even yourself to check your sugar. It starts there, and it goes until the AI hospital, AI systems being used in King's College University of London, which will automatically filter patients who has possibly high risk of cancer and low risk of cancer automatically. So it's a huge spectrum, if you ask me, right? All of this falls under eHealth or healthcare IT. But that's not enough, right? So let's take an example of a hospital. Let's take something which is very, very relevant to you. One of the important aspect in a hospital is to manage your medical records. I'm sure you have still been to our clinic, where the minute you go to a clinic, the first thing they'll ask you is, my card mana? IC mana? And then you give your my card, and then, you say, saya tak bawa my card, I lupa lah bang. And then, sorry for the Malay, I'm using Malay language. Some of you may not be familiar with the language, but it gets nice when I go localize, my card is your ID. Then once you give your ID, the nurse or the clerk will take the last four digit, and she'll start searching. And if you're in luck, she'll find the card straight away. If your luck's no good, she'll go into the medical records where all the papers are stacked up. So many cards will be there. And after 10 minutes, she'll come out and she'll ask you, "Pernah datang ke? Tak jumpa kad?" And you may get angry. You'll say, saya baru datang last week. I just came last week. Then she'll go in again. So this is to manage medical records actually. Okay. So if you have a medical record system, EMR we call it, okay, that will greatly improvise productivity. It will greatly improvise your search time of the nurse going looking for your card. It will greatly improvise your health, your patient experience. And of course, it will improvise your standards in security, because healthcare is governed. The medical record paper can be taken out of the clinic anytime. Okay? And if you piss off the nurse, you may just tear it apart. All right, I've been there before. Okay, moving on. So this is a very practical look at in a hospital or clinic environment. But let's look at overall picture, right? Overall, what are the systems which have been deployed, which are there working right now in the healthcare IT environment? Bear in mind, I'm not talking about future. I'm talking about the current systems in place. All right. Let's take a hospital or clinic. All right. So I'm going to be throwing a lot of alphabets to you. I hope you can bear with me. This will tell you how niche is this market. Okay, let's start. Starting with CIS, your clinic information system. Okay, again, some clinics have got a bigger system, many subsystems, and combined together, they run the clinic. You have your HIS, hospital information system, all right, which in other words, is an ERP for the hospital, right from the part where you register as a patient, your name goes into the waiting list of the doctor who's sitting inside the room, and the same name goes to the queuing system up there, and doctor gets to double click on the patient's name, and your queue number or your name blinks, and you start walking into the doctor's room, And the whole thing until you go to the admission discharge counter for billing and payment. All right. Then you have your EMR. Now EMR can exist, your electronic medical record can exist with or without HIS. That's a different story altogether, how and why it happens. There's two reasons, huh? How and why. There are two reasons later. Your PACS is your picture archival and communication system. Basically, this is one software, one system, which talks to all of your imaging system, okay? Your CT scan, your X-ray, your ultrasound, your MRI, anything else which produces picture will talk to this software, all right? It's managed differently. RI is a radiology information system, but it's meant for, not for image, it's meant for scheduling, appointment, workflow. The minute you register, you call, make an appointment. Let's say you call Pantai, you make an appointment today for your knee scan, CT scan or X-ray next week. The truth is, if it's integrated well, your name, your IC, your MyCard number can go into the machine the very moment itself. That is why sometimes you take X-ray, the traditional one especially, you can see your name printed on the X-ray image itself. Okay? If you're wondering why, that is done via the integration between HL7, which health level 7 data from the booking system of RIS, directly integrated with the DICOM server, which is inside the PACS. If I'm confusing you, so just bear with me, okay? Okay, next you have various diet system, other ERP system. You have so many systems to connect to each other. For that, you need a gateway, you have DICOM server, you have practice system, nursing informatics. Nursing informatics is mainly how the nurse, you know, nurses, right? How the nurses takes care of you and so on. I think I'm running out of time, so I'm just going to glance through. Okay, your CPOE, your clinical procedure order entry, your clinical decision support system, and so on, right? Moving on. Okay, just now it was the hospital, clinic, or even group of hospital, group of clinics. Now we go a bit national level. At the national level, you have HIE, your Health Information Exchange. That's where your EHR sits. The EHR is static to a large extent, but HIE is an exchange platform. Think of it like if in the future, different hospitals in one country, all right, maybe Sing Health and Rafflesia Hospital in Singapore would like to exchange data, right? Or Pantai and KPJ and Asunta would like to exchange data. They will go through a national level exchange server. That's what HIE is. Your public health system. So whatever our Director General Dato Hisham right now is doing is a part of the public health infrastructure. Of course, he's governed by the statistics. I'm sure all of you are checking your daily coronavirus reports. Every day, you know, what are the statistics, what's the death rate, what's the infected rate. That data comes from your public health systems. All right, your national data warehouse. If you're familiar with the GLC called MIMOS, MIMOS. So they govern the Malaysia Health Data Warehouse. They have done an excellent job in Malaysia, you know. So National Drug Database. This is governed by our MOH, Ministry of Health in Malaysia. How do you name various different drugs, you know, in different hospitals? So there's one taxonomy, how that's governed. Your disease registry. So disease registry in Malaysia is also governed by MIMOS. If I'm not mistaken, some of you may be from MIMOS right now. Correct me if I'm wrong. We have about 17 different registries, if I'm not mistaken. For every disease, there's a registry. Okay, so what is registry? We can talk about it later. Then yeah, going on. So we have blood bank system. Okay, moving on. We have the insurance. So many of the time, we look at insurance separately than healthcare. Actually, it belongs to the same industry, but insurance is so big because it's driven by fintech, obviously, right? It is so big that it has got a life on its own, and it's called InsurTech. So InsurTech, if you draw a Venn diagram, a set diagram, it's a cross between healthcare and fintech. It's difficult to exist on its own. All right, that's on InsurTech. All right, I'm looking at my time as I speak. Yeah, next is the pharmaceutical industry. So you must think where your drugs comes from, and that plays a huge role because you wouldn't want to go to a hospital and for them, the hospital say, sorry lah bang, we are running out of paracetamol. That'll be weird, right? So There are systems, which is an end-to-end logistic system. There also a system which handles the end-to-end from the manufacturing up to the retail industry. Okay. About 7 to 8 years ago, Malaysian government under the Najib's leadership at the time came up with a concept called One Care, number one, CARE. And this is the national level insurance. Similar thing has been deployed in Indonesia, I think about 3 years ago. It's called BJPS. That's the national level insurance. And then even Philippines is going for the similar model called UHC, Universal Healthcare Coverage. This is very similar to the UK government's concept, where every citizen has got equal rights to access to public healthcare with involvement of the insurance industry. Now, why I'm talking about that is that has got to do with retail pharmacy industry, because there will be a time that you can get a prescription either electronically on your phone or physically, and you'll be able to walk into your Caring pharmacy or your Watson pharmacy or Guardian pharmacy or any other retail pharmacy, given your ID, your national ID, that pharmacy will be able to access the prescription produced by the medical doctor sitting in any government or private hospital. All right. So if you can imagine, that is the extent of the supply chain. Okay, that will require a end-to-end integration. Right. So last but not least, the most important portion of all, the patient portion, and I think we spoke about this, the mobile apps, the IoT devices, the mHealth. mHealth term now is not being used, unfortunately. It is a good term. At the advent of mobile apps growing, we had a term called mHealth, but now it's not being used much. So anyway, all this encompasses healthcare IT. Now moving on.